My name is Adam Gubb. I'm the Public Information Officer here at Gaston County. I'll be moderating today's event, which we're calling COVID-19, the Fight and Our Future. Joining us today, we have a distinguished panel of elected officials from across the county. We're also joined with public health officials, private health officials, as well as those that are working in various relief efforts for those that are affected by COVID-19, either on the health side or on the economic side. How we're going to start today is we're going to do sort of a round robin. We're going to ask questions that have been submitted from the public of each of our panelists, and then we're going to open it up to questions that are coming in through our Facebook Live feed. DeAndrea Bradley, who's our Deputy PIO here at the county, is going to be monitoring that Facebook Live feed, and she'll be giving those questions over to me. So once we get through one question each for each of the panelists, then we'll open it up to that. What I'm going to do is I'm going to start with our list of questions. These have come in from residents over the past few days, and I'm going to start with Dr. Ward Adcock, who is joining us from Caramount Health. Dr. Adcock, let me read the question for you, and then I'll let you respond. What steps should people take in public to protect themselves and their families during this time? Should people be wearing masks, and what other precautions should they take? Dr. Adcock, the floor is yours, sir.
Thank you, Adam. That's a great question to start out with. There's one thing that we know for sure about this virus, and that's that it is a very infectious virus. So it is easily spread between contacts. So the most important thing you can do right now to protect yourself and your family is to maintain that 6-foot social distancing recommendation. The closer you get to someone, the more likely you are to encounter someone that either has the virus and could be symptomatic, or even more importantly, could be asymptomatic and carrying the virus. So social distancing is very important in order to maintain enough distance to not encounter the virus. It's a very good question about wearing masks in public. So there's a couple of things to realize with a surgical mask. Right now, the CDC and the World Health Organization indicate that the only real reason to wear a surgical mask is if you're going to encounter someone that has the virus. So that's healthcare workers that are working closely with individuals that have the virus or potentially do have the virus. Or if you're a family member taking care of someone with the virus. And in that circumstance, you need to be sure that you're wearing a properly fitted, what's called N95 respirator mask in order to prevent infection for yourself. Now, a surgical mask doesn't prevent you from getting infection. It prevents you from spreading that infection to others. So the CDC also recommends that if you're going to go out into a public place and you feel that you cannot maintain that safe 6-foot social distancing recommendation, then it is appropriate to wear a surgical mask in those situations. But there's a couple of things to keep in mind if you choose to wear a surgical mask. And one is that you need to be sure to use proper hygiene with the mask. Be sure you're taking it off carefully, removing it from your face, not touching the front of the mask, washing your hands before you touch the mask, washing your hands after you take your mask off, placing that mask to the side and not touching the mask and then touching your face. We do know that the virus lives for about 72 hours on solid surfaces. So if you are going to the grocery store where you're going to encounter a large number of people and may have difficulty maintaining that safe social distancing rule, then wearing a mask is appropriate. When you come home, taking it off, placing it somewhere and letting it sit aside for a few days will allow the virus to no longer live on that mask, and then you could use it again at that particular time. In this circumstance, it's always important to keep in mind the most important thing, which is good hand hygiene. Using good hand hygiene prevents any infection, whether it's COVID-19 or any other type of infection. Covering your mouth when you cough or sneeze, and staying home when you're sick.
Excellent. Dr. Adcock, thank you so much. We're going to move now to Robert Spencer, who is the CEO of Contegra Health. Mr. Spencer, the question here is for you. Should people change the way that they interact with their doctor or their primary care provider? And let me unmute your microphone, and you're good to go, sir.
Thank you, Adam. So we know now that our community, as well as most other communities, are under a stay-at-home order now as issued by the governor. And clearly, that would indicate that for other than absolutely essential needs, one should not travel outside their home routinely. And that would include reference to your own doctor's office. In response to this, many doctor's offices, if not all, have established alternative ways of communicating with their patients and having those visits as necessary continue for things like chronic disease issues, and even in some circumstances, COVID-19 symptoms themselves. This can take the form of what we would refer to as a telephonic visit with your provider, which I am sure all primary care and specialty providers are engaged in at this point in time, as well as video two-way communication, what we refer to as telemedicine visits with your provider. The important thing is to make sure that you reach out prior to any visits that you currently have scheduled. And in the future, if you have needs, that you reach out telephonically to those offices and get complete instructions as to how that visit will be conducted. Thank you.
Perfect. Thank you, Mr. Spencer. We appreciate your response to that question. I'm going to move now to Linda Slade, who's the president of Gaston County United Way. Linda, what sort of projects have been funded so far through the virus relief fund that the United Way helps get started? And then kind of as a follow-up question to that, what sort of needs are being met through the fund and what more really needs to be done? Let me unmute your microphone and you're good to go.
Thank you, Adam. As you know, the Gaston County Virus Relief Fund is a collaboration between many areas across Gaston County. It's jointly administered through the United Way and the Gaston Community Foundation. Just a little background to date, we have received, 44 applications requesting assistance through the fund. These are from 501c3 organizations, nonprofit organizations, as well as small businesses in Gastonia, as well as individuals that go in that too. And we've received $752,000 in requests for funding from the fund. To date, we have funded 23 nonprofits and to the tune of $165,917. The committee has been looking primarily at those organizations that provide crisis assistance. We see more requests in needs for food and shelter, rent assistance, those types of things is what we're seeing the most of right now. So we funded several agencies throughout the county for those type needs of citizens of our county. We've also been helping some nonprofits who have suffered due to the fact they cannot do their annual fundraisers that support a lot of their needed work. For example, we have funded the Heart Society of Gaston County that provides critical medications for cardiac patients. They were not able to have their spring run and their walk at the hospital, so they're asking for help so they do not have to discontinue that work. Cancer Services of Gaston County, the same thing. We're trying to make sure that these organizations still have those resources to be able to carry on the business that they do, vital business that they do in this community. Additionally, Habitat for Humanity, you probably would not think of that, but there's several people that are impacted because they cannot pay their mortgages. And so we've helped fund April mortgage payments for several of those that are under the Habitat program so they don't get any further in debt. So there's a whole lot of needs that are coming in. The fund is very flexible. It's a very organic type fund in the sense that where we see the most needs, we are trying to meet those needs, and they could change from week to week.
Awesome. Thank you so much, Linda. We appreciate kind of the insight that you're giving us as to what you guys are doing there through the fund. Let me move on to what is the Gaston Community Faith Task Force that's co-chaired by Bishop John Mccullough and Pastor Austin Rammel. I'm going to start with Bishop Mccullough for this question. It comes from Cece Campbell. She asks, could you please share information on how to donate and volunteer items, money, or time? She asks about, making homemade masks, helping with food, deliveries, shopping for at-risk people, giving money, or et cetera. And then also any ways that citizens can help out the city, the county, and each other. Bishop Mccullough, I'm going to let you answer, and go ahead, sir.
All right. Thank you, Adam, and good morning, everyone. We're collaborating with churches and pastors and faith organizations to provide food and that type thing. And we would like to ask that citizens would first go to their local community, to their local churches, and find out what the needs are in those areas and try to assist there. And then we also have a website that Austin is going to share information about as to how they can further get involved outside of their immediate communities. So if you could, Austin is going to share that.
Awesome. And Austin, I'll let you take away the second part of the answer.
Yeah. We launched a site, Escape Plan Marketing donated their time to do it. It's called GastonCovid.com. And on that site, we have all kinds of information related to resources that we as pastors have vetted. So we have a task force of 18 pastors and 2 church networks. The GC3 is a very large church network. The executive director is on the task force. And the Greater Gaston Baptist Association, which I believe is the largest network of local churches in Gaston County in a denomination, that executive director is on there as well. So we've got a great diversity on that group. And so what we've been doing is vetting as many nonprofit organizations as we can on their capacity and potential capacity. And so we've identified different second harvest sites. We've divided this county up into 4, and we have a north, a south, east, and west, and we're bringing 2 tractor trailer loads a week of food comes into that. That's about 24,000 pounds of food that's coming in each week, and we're supplying those sites. So each one of those sites needs volunteers to be able to hand that out. There's also a lot of other organizations on there. The Gateway, we're partnering with Gateway right now. If you go to our website, we also have a list of, I believe, 18 counselors that have all been vetted by the people on the task force. In other words, we gave everybody veto power. If one pastor organization had a bad experience, that group got marked out. So all 18 of those are ones that everybody agrees they've had great experiences with. And so we're working with the Gateway. If you're in a situation where your marriage is really being impacted or one of those types of things, then you can call the Gateway. The Gateway will route you into one of those counselors and help financially support you. We're applying for grants for that. But the Gateway needs volunteers to take those calls. So if you go to our website, you can see there's a website for the Gateway, as well as a text that you can send and just say, I want to volunteer. And they'll be in touch with you within an hour and a half and get you set up with a virtual training. So all of those organizations have different needs for volunteers in different capacities. And so if you're interested, look to see one that maybe is near you. But I want to echo what Pastor Mccullough said and encourage you to first identify your community and a church or a nonprofit organization that's in your community that you can go and say, hey, I want help. And then begin to relate that to the people you know in your neighborhood, in your family, that are involved in your workplace that have needs. Meals on Wheels to be able to supply for senior adults that can't get out of their homes. There's just all types of organizations. You can start our website, but don't skip your own community and the ones that are right around your corner when you're trying to consider where to give your time and your money.
Pastor Ram, I think that's some really good information, and you guys have done a great job of developing that website and getting those resources marshaled. So we really appreciate that. I'm going to turn the next question over to Board of Commissioners Chairman Tracy Philbeck. Good morning, Commissioner Philbeck. Let me ask you a question. This is coming from Dr. John Pallinero of the New Covenant Church. He asks, my staff and I, and sorry, I just lost the document there real quick. My staff and I are wanting to know if at the end of the month, and that's the end of April, what allowances are you considering for the church and churches in the county? Presently, we're live streaming with less than 10 workers in the service to facilitate the live stream. We're thinking as possibly a suggestion that 50 or less in service with separation whenever the next phasing will start. He asks what county leaders are considering at this moment. Mr. Chairman.
Thank you. Let me first begin by saying thank you to the faith community. The response has been absolutely overwhelming. The support and just working together and having churches willingly police themselves for the sake of others in their community is definitely a sight to see, and definitely gives me hope for humanity. With that said, the governor's order currently will last until April the 29th. No one knows yet if he will extend that or if that will be able to come back and allow counties more ability to control those things. With that said, there are a lot of metrics that we need to look at when it comes to deciding how we limit gatherings and open those things back up, which is going to be very slow and incremental. So I wouldn't get hung up on the date as much as how we reopen whatever that will be in the future should be driven by data, not necessarily a date. So what we're looking at, that if our numbers continue to hold, and we can see from our healthcare professionals, health department, and local data that we have flattened our curve, what I hope to do is be able to open, whether it's a church or a business, with limited gatherings, safe restrictions such as masks, gloves, and things of that nature. But again, the data is going to drive that. Thank you.
Thank you, sir. We've got a question here that I'm going to ask for three of you, and I'm going to start with the Gaston County Social Services Director, Angie Karchmer. Angie, the question comes in, if the CARE Act is working like you stated and promised, why are we pushing so hard to reopen? And that comes to us. And Angie, I'm going to ask you specifically about the CARE plan. It's kind of your department that's been in charge of managing that, and I'd like you to speak to kind of what it's done so far today.
Hi, Adam. Thank you. The CARE plan was established through the Board of Commissioners here in Gaston County. They allocated funding for this to help our citizens who've been impacted by COVID-19. They allocated $1 million to this fund, and we have really seen a lot of interest from our community. To date, we've received over 1,000 inquiries and applications. We're doing those applications by phone. We have approved to date 153 of those applications. There has been some of those that have been screened out, but we are looking specifically to help individuals and families that have been impacted by COVID-19, whether that's loss of a job for one individual, daycare closings, them having difficulty paying mortgage or rent, or car payments, again, due to the loss of a job through the impact of COVID-19. We have already issued over $120,000 from this fund to individuals and families in our community. And this really is more of a stopgap for our residents until they can begin to receive unemployment or the federal stimulus checks begin to be issued. But we've really seen a lot of interest in this, and quite frankly, we've seen a lot of individuals be very grateful that the commissioners set this fund up for them.
I'm sorry, I had myself on mute. Boy, that was silly. Vice Chairman Brown, I'd like to bring you in for this question. The second part of this is about what the Family Advisory Board has done. And you've been given $100,000 by the Board of Commissioners to go out to nonprofits. And can you talk a little bit about what that process looks like?
Sure can. We had a meeting yesterday afternoon, and we had the $100,000 to distribute between 16 agencies that have replied and requested for funds. These funds, as you mentioned earlier about what they were for, some of them are for transportation, some for rental issues, some for food, various other items that they have on their list that qualifies for this fund. Now, this was 16 different organizations that we distributed these funds for that go out at the end of this month. And so we will be distributing those funds at the very latest, maybe the 30th and probably the 1st of May, but we distributed between 16 different agencies, and we'll be getting these funds anywhere from $3,000 to $9,000. So it's quite a task it took to get through this, but I'd like to add one other thing to this as well. We will be meeting again next week for the budget year for 2021, which will be an additional $100,000, which we will be dispersing through the various agencies that need it, and those requests have already come in, so we'll be going through those next week. So there'll be additional funds going out after the budget is passed. June or July. That's what I have. I hope that covers your needs.
Thank you, Mr. Vice Chairman. And I want to conclude this question with go back to Chairman Philbick. Maybe, sir, if you can talk a little bit about the idea behind the care plan and what the vision was when it was put in place.
Okay, and can you repeat the exact question as well?
Let me go back and read that for you. So if the CARE Act is working like you stated and promised, why are you pushing so hard to open as soon as possible?
Okay, great question. First, I think you've heard from Vice Chairman Brown and our health department when it comes to the data. It's working. It's helping people pay their rent. It's helping people provide get daycare supplements, prescription drug, and things of that nature. So the program is absolutely working. Why are we looking at supporting opening up in a slow incremental way once the data shows we can do that? Is this: the care plan is meant to be a stopgap. When the governor issued his orders, the stay-at-home order, and he told people that there's certain businesses you cannot work, you cannot earn a living, you have to go home. There's been a problem with those individuals getting unemployment. I think it's widely reported on a national level and a state level that hundreds of thousands of individuals have been laid off of their jobs or told by the governor, you have to shut your business down. But at the same time, the benefits to help those individuals they haven't met yet. They haven't been dispersed. I can tell you countless stories of individuals in our community that's been laid off since March, and people that are losing everything they own because their business has been shut down. But the government, the slow bureaucratic machines of Washington and Raleigh, is just taking so much time to push that help down to the people. So the care plan, Gaston County cannot print money like the federal government can. Not only that, we have to have a balanced budget. So what we've done is taken what we can do to fill in the gap, but that's not going to meet the need long term. And we don't have enough money to meet all the need long term. So what I'm pushing for is this: once the governor's order expires at the end of April the 29th, it is our hope, if the data And that's what we're talking about, not a date, but the data. If it continues to show that Gaston County is flattening the curve and we have capacity at our hospital and our health department and our health leaders agree, we've got to put people back to work, because for every action, there is a reaction. And although I think we've taken the appropriate measures to keep our citizens safe, telling people to go home without providing any type of benefit to help them pay their bills and feed their family is not a long-term sustainable solution. So my hope is that we can get people back to work in a safe manner, at the same time protect the health of our citizens. Thank you.
Thank you, Mr. Chairman. For those of you that are just joining us on Facebook Live, we're about halfway through our first round of questions. We started this event with questions that had come in before the event started. So those that were either sent to us through Facebook or that were emailed in to the Public Information Office. Once we get through the initial round of questions, we're going to be going through some of the ones that you all are asking here on Facebook, and we're making a list of those, and we will ask those here in about the next 20 minutes or so. We've gone through about half of our panel, and let me go now after that question for Chairman Philbeck. I've got a question here that would be a good one for Pat Mumford, and Pat Mumford's representing the Business Task Force. Pat, this comes from Crystal Shields, and she says, I'd like to know what assistance is available for my husband. He's self-employed and our sole income provider. He owns a small used car lot and his business is stopped. My husband has no other employees than himself. I know about the assistance available to pay employees, and it's forgiven, but I'd like to know what is available if you don't have any employees. Mr. Mumford.
Thank you, Adam, and thank you, Ms. Shields, for that question. So the Small Business Administration, the SBA, has several programs that are available, and those are actually for sole proprietors and self-employed employees. I'm sorry, individuals. So the programs you referenced, they started as small business with employees, and they've now shifted to sole proprietors and self-employed. Our website, GastonBusinessSupport.com, provides links to information and applications for both the SBA Economic Injury Disaster Loan Program and the Paycheck Protection Program. You can also find this information on the county's coronavirus information page. Now, one thing I want to mention, though, is I did hear this morning that those program funds are now completely allocated. But that said, given the discussions that are occurring in Washington to send additional funds to those programs, I would recommend that you go ahead and apply, have your husband apply, so you're in line for the increased funding when it arrives. Locally, Mount Holly and Belmont have each put together an emergency loan program. We have that information and links as well on our site. And I also saw this morning, I want to make everybody aware that the U.S. Chamber of Commerce has created a new grant program for small businesses. And these are businesses with 3 to 20 employees. The grants are for $5,000, and they're going to be based on what are considered economically vulnerable communities. And we've checked, and on most of the zip codes here in Gaston County make them eligible for these grants. That will go live, as I understand it, Monday on the 20th, and we'll be adding this information to our site today. As Chairman Philbeck mentioned, there's an awful lot of logjam in the process on unemployment, but also the process for these funds from the federal government. It's been a huge endeavor, and people have been finding it difficult to go through banks and get these loans in place. I have been hearing some good news, though, of late, that folks are receiving money and have been approved for loans. So I would suggest just continue to be diligent, make those applications, put them in, and stay up on our website. Again, that's GastonBusinessSupport.com. As information comes in, we'll be posting it there.
Thanks, Pat. That's great information. And as Pat mentioned, The different folks that are really helping in this effort, whether it's the business community, the faith community. There's information about the care plan. We have it all on gastongov.com/coronavirus, and we've got links to all of those pages and all of those resources, so that it's easily accessible to anybody that's looking for that. Let's move next to a question for the Gaston County School Superintendent, Dr. Jeff Booker. Dr. Booker, thank you for joining us. This comes from Tyler Sprinkle from Girls on the Run, Gaston County. Tyler asks, will the meals for children being offered through the schools continue through the month of May? Dr. Booker, the floor is yours.
Good morning. Thank you for allowing us to participate in this. I'd like to start by just recognizing all the first responders that are serving our community. It is just amazing to me to watch all the work that has gone on, and our school nutrition workers are part of that first responders. And to date, over 189,000 meals have been provided to our community through the Grab and Grow program. And that is a great testament. Earlier in this call, we talked about the faith community and what it's doing. We have some churches that are coming to our sites and picking up 50 and 100 lunches and taking them back and distributing them. I know of 2 teachers that are coming and getting 50 and taking them into a housing community and distributing. So there's a lot of great work going on in our community to make Grab and Go successful. Our intent is to continue to provide the meals as long as we can. There are challenges with supplies, as everyone has seen, and trying to secure supplies for themselves personally. Our supply chain does have some strain in it, but as long as we are able to secure the product, we intend to do that. I will say for the community, we will look at going to a 4-day week. We tried that last week with coming into spring break, and it was successful, giving 2 meals on Thursday so that we don't operate on Friday. So we'll look beginning next week to go to a Monday through Thursday operation. Thank you.
Good deal. Thank you, Dr. Booker. Let's move now to Dr. Tia Robertson, who's the medical director here for the Public Health Department of Gaston County. Dr. Robertson, good morning. This question comes to you from Shannon Jones, and there's actually it's kind of a 2-part question. So the first part from Shannon, she asks, what numbers and data are you utilizing in your decision making? And then the second part comes from Penny Stubbs, who asks, the CDC has changed the way that deaths are being reported. Has that impacted the county numbers? And let me make sure that I've got you up. Dr. Robertson, the floor is yours.
Good morning, Adam. Thank you for the invitation to participate this morning. The Gaston County Department of Health and Human Services work in collaboration with Caremont Health and Contegra Health in following the state and federal guidelines when we're interpreting the data. We considered the number of new cases, the number of tests available, contact tracing, trends following the deaths that are reported, hospital admission rates, and the hospital capacity. In regards to our reporting of deaths, as the COVID-19 pandemic continues to evolve very rapidly, the CDC will continue to refine their process in reporting and tracking the death rates, and we will continue to follow suit with them. Currently, we are very confident with the numbers that we reported to the state at this time. Thank you.
Thank you, ma'am. We've got a question now that I'm going to ask to both Mayor Walker Reed of Gastonia and to Mayor Rick Coleman of Dallas. I'm going to start with you, Mayor Reed. Question to you. Have any government officials been out to the community, not to make an appearance, but to go to some of the homes and personally talk to people, making sure that you understand the hands that need? Mayor Reed, the floor is yours.
Thanks, Adam, and thanks for allowing me to have an opportunity to share. Personally, I don't know if any government official has been to anyone's home, but I'm in the community every day. I've heard from my citizens on social media. They have called my office. They have inboxed me as well. We know that this is very uncertain times right now, and we know that people want answers, and we're doing our best to make sure that we are getting important information out to them. The biggest thing that we've heard from our citizens in relation to the city is the concerns about the utility bills. And because we were out early talking to residents and hearing their concerns, we were able to work closely with our community partners and respond by offering no disconnections for non-payment for utilities, eliminating late fees on utility accounts, and working with the Virus Relief Fund, which has been mentioned earlier, and offering donations through our Good Neighbors program in conjunction with City Church. So we tried to get out early to help in that manner. And also our city employees are still out in the community daily. They are conversing with citizens and they're sharing with us the needs of the community. So we're very concerned, and we're doing right now with our marketing department trying to keep our citizens abreast on social media as well with what the city services and what we can do at this time. Thank you.
Thank you, Mayor Reed. Let me turn it over to Mayor Coleman. And sir, would you like to have me repeat the question, or are you good?
I think I'm good at it. Thank you. Before the stay-at-home order, yes, I was out in the community even before the school started feeding the children their lunches. First Baptist Church here in Dallas had a program where they were feeding all the kids that they possibly could at Carr School. And I was involved with Reverend Frank Milton there, helping them out just a little bit and trying to round up some donations. Since the stay-at-home order, I have not been out in the community, trying to stay home like the governor and the county commissioners have asked us to do. But I have been on the phone with some people. I haven't had too many complaints. Probably our only complaint is closing our town hall. And I think it was just a more of a habit for people to come to town hall. Not that much of an inconvenience. We've made it pretty easy for people to pay the utility bills.
Thank you, sir. I appreciate it. We're going to get in now. We've gone through the round robin of questions submitted in advance. We're going to get to some of the questions that you've been asking here on Facebook Live. This one is going to go to Dr. Booker with Gaston County Schools, and it's a popular question that's been asked by a few folks. This comes specifically from Marianne Burris, who asks, hi, has anyone heard anything about schools starting back up after May 15th? Dr. Booker, what insights have you been given from the state on that regard?
At this time, Adam, there has been no further direction given. The governor has been pretty adamant that he would like to consider some form of the schools reopening, but the last call that we were on last Thursday, he continued to say in our current situation, we would not be reopening anytime sooner. So what we know for sure is that not prior to May 15th, which actually would mean May 18th would be the Monday following that.
Got it. Thank you, sir. We've got a question here that comes from Tori Pearson. And Dr. Robertson, I'm going to start with you. She asks, specifically, what areas and neighborhoods are experiencing COVID-19 cases disproportionately? I am concerned that Charlotte has a significantly higher percentage of COVID-19 cases with African Americans and in predominantly African American neighborhoods. Are we experiencing the same thing here in Gaston County? Dr. Robertson. Sorry, let me unmute you. Dr. Robertson, can you hear me now?
Yes, I can. Can you hear me?
Yep, go for it.
Excellent. Adam, that's a great question. There's been a lot of discussion in the national news regarding disparities for African American communities. In Gaston County, Gastonia has the highest number of COVID-19 cases. And when we look at the numbers, we have a general population, 18% of our general population is African American. And as of today, we have about 27% of African American population affected with, or of our cases, of our positive cases for COVID, we have about 27% African Americans. So with that being said, we are aware that there is consistency with the national trend with there being a higher rate or higher penetration of COVID-19 in the African American community. We know that we have areas like the Highland area that we are focused on in terms of evaluating what's going on and what we can do to improve those numbers. We've already started working on a plan with our community partners, our faith-based leadership to reach out to the communities and work together to develop more testing if needed, and also to offer other resources to improve the general health of the African American community.
Thank you, ma'am. That's a great response. I think there's an interesting question here that I've seen pop up that I really hadn't even thought about. And this, I'm going to ask this for Dr. Adcock. Sir, Debbie Evans is asking, do I have to worry about getting the coronavirus from a mosquito? And I'll let you respond to that.
Yeah, that's a great question. Currently, there is no evidence at all to support that this is spread through any kind of vector like an insect, particularly a mosquito. It appears that this is, again, spread from close contact with someone else that may have the virus either through droplet or contact type of spread, meaning that person may cough or sneeze, and those droplets are then released into the air, and then you would breathe those in and acquire the virus that way. Or it can be spread, like I said earlier, on solid surfaces. It can live on those surfaces for a number of hours, and some think even up to 72 hours. So again, hand hygiene is really the most important thing that I can stress on this call today is wash your hands frequently, take hand sanitizer with you when you're going out, cover your mouth and nose when you cough and when you sneeze, and practice good social distancing.
Good deal. Thank you, sir. I'm going to ask this question for Robert Spencer from Contegra Health. Robert, there's a question here from Daniel Neitzold, and he asks, does Gaston County have the expertise to handle this crisis? The required resources and PPE, rapid testing and manpower. Just if you can talk a little bit about what Contegra has done for the communities and just respond a little bit to Daniel's question here.
Well, I would say that our healthcare providers within this community have really come together in this crisis. We, Contegra, have worked very closely with the Department of Health and Human Services, our health department in town under the direction of the medical director there, Tia Robertson, as well as Caramont, who have been very engaged in coordinating activities across the county. We hold a daily call of our organizations as well as other entities within the community who are focusing on this pandemic that we're working through here together. To your question specifically, when we talk about, there are shortages. There are shortages of testing supplies. There are shortages of the appropriate PPE. And we still don't know exactly what the arc of this disease is going to look like for us. So we have been, I won't say we've been slow, we've been very pragmatic and practical in our approach to expanding screening opportunities within the community. To this date, we are only providing any screening opportunities to folks who are asymptomatic. You may recognize that early in this process, CDC's recommendation was that if you had mild COVID symptoms, you should just stay at home. Don't even come out and visit the doctor. You should quarantine yourself for that period of time. And that's the advice we had been given to provide our patients. And that was the community standard. Now, with the help of Caramont, and they have been able to receive certainly more, though not an abundance of testing supplies, we are now routing patients who have those mild symptoms to a testing center. Now that has to be through your doctor. You can't just show up at that testing center. So if you communicate with your physician and it's determined that you are exhibiting those symptoms appropriately, you could receive a referral for that sort of testing. And I would say that just overall, we have really come together as a medical community and are working collaboratively to make sure that we are aggressively trying to move forward in the treatment of those folks that are having difficulty with the disease. Thank you.
Thank you, Mr. Spencer. Got a question here. I'm going to ask for Mayor Reed. Got a question about Gastonia, their East Rotary, and the city of Gastonia. We're looking to have concerts in mid-May on the 15th and the 16th, and then May 29th. Do you believe that we'll be able to have those concerts at those dates on the Rotary Pavilion in downtown Gastonia? Mayor Reed.
Thanks, Adam. Very good question. At this time, it's hard to say. I was trying to hold out to the end of this month and see where we were as far as numbers. The Rotary mentioned that in the last council meeting. I was somewhat shocked, but we gave them that opportunity to present their schedule for concerts. Hopefully by the middle of May, it may be a good time. It may not be a good time. That's a very difficult question to answer at this time. Thank you.
Thank you, sir. I've got a question here for Mayor Coleman. The governor put an order in keeping utilities from turning off water or electricity. And I know Mayor Reed talked a little bit about this earlier. But once that order expires, what help is going to be available to residents who are still out of work and can't make ends meet? Mr. Mayor.
Yeah, Adam. Part of the governor's order also included that we the utility providers, set up a payment plan that would allow people 6 months to get caught up on their utility bills. So we will have that in place. I think we already have it in place, as a matter of fact. And also here at Dallas, we have a list of agencies that can help with utility bills, and we have address, phone numbers for those agencies. And our two people up front, Patrick and Lisa, will help people get in contact with the appropriate agency to help own the utility bills. So I think we can work with people pretty good and get everything covered and help them get caught up.
Excellent. Thank you, sir. Let's move now to a question for Angie Karchmer. And this is, Angie, this has been a really big question. Obviously, we saw this morning the national numbers that there's now 22 million people that have been put out of work and have been applied for unemployment across the country in the last 4 weeks. And one of the big questions is, we haven't even gotten our unemployment check. How should we kind of proceed in this process and the process?
Thanks, Adam. That's a really great question. North Carolina was not prepared for the overwhelming drain on their unemployment benefit system. Those benefits are issued through the Division of Employment Security. My understanding, as of yesterday, there's been almost 600,000 claims that have been submitted to that center to receive unemployment throughout the state of North Carolina. Typically, they would receive less than 3,000 claims a week, a day, actually, 3,000 claims a day. They are on average now receiving around 20,000 claims per day. So you can see the huge increase in the need of unemployment for not just our county, but for the state as a whole. This Department of Employment Security has expanded their ability to take claims over the phone, also to take claims online. They are continuing to hire additional staff. Understanding is around 500 additional staff are going to be coming on if they have not already done that. They're still looking to hire for that, but they are quickly as government can do that, and as efficiently as they can do that, processing those claims. We are continuing to advise all of our residents to continue to attempt to apply. The Department of Employment Security will retroactively fill out those claims for you. They will review those claims and determine eligibility. It's also my understanding that this week, the additional $600 that is being issued from the federal government for unemployed individuals, those funds are starting to roll out. So that's a very positive. We're seeing additional funds come into our community from the federal government for those individuals that are unemployed. Also, it's my understanding that we're starting to see some of the federal supplements of the $1,200 also roll into our community as well. Lots of folks have reached out to us and let us know that they have been able to get through. Again, we're just continuing to ask people to please be patient and continue to access that website and the number. Adam, I believe we're going to put that information up on our website. Is that something that you want me to provide now, or is that something that you can gather after we conclude?
We can put all that together. That's all there for folks.
Okay, great. Just a quick update as far as our unemployment rate in Gaston County. Our February unemployment rate was 3.8%. We will not have, and that February rate was not impacted in any way by COVID-19. Our March unemployment rate, we will not have that data until early May, and we do expect to see significant increase because of COVID-19.
Excellent. I've been got a note here from Austin Rammel about kind of the federal money, and I just wanted to bring him in real quick on this because it's just kind of a personal experience with what he's seen.
Yeah, had a pretty nice little surprise this morning when I was doing my morning check my bank account stuff, and I noticed a significant increase in my checking account. We file our taxes every year online, and we do direct deposit or direct payment for when we're done with our taxes. And so the federal stimulus money is actually starting to show up in your checking account now. If you do online taxes, pay attention because you're about to see a big, huge check pop in there.
Excellent. Thanks for letting us know about that. There's a good question that we got here from April Presler, if I'm saying her name correctly. And I'm going to ask this for both Robert Spencer and Dr. Adcock. And Dr. Adcock, I'll start with you. She's asking, when are doctors going to be allowed to perform surgeries again? And Dr. Adcock, let me get your microphone unmuted, and we'll start with you.
That's a great question. There's a lot of people in the community that are in need of some surgeries, some elective surgeries, and some surgeries that really might be considered non-elective. So early in the process of this pandemic developing, we put together a conference call that we were involved in that included all of the health systems across the state. So Atrium, Novant, Wake Forest, Mission Hospital in Asheville, UNC Chapel Hill. And that group decided collectively to suspend all elective surgeries, all elective procedures within the hospital, and to pare that down just to essential services to avoid patients contacting patients with the COVID-19 virus. That group continues to meet, and we are still involved in that. That group meets daily on a conference call, and these things are being discussed on a regular basis. Right now, that decision has not been made by that group. We are following the lead from the state. We're following the lead from the North Carolina Hospital Association. And as I said, these large health systems, we're all discussing when we think it will be safe to begin to resume elective procedures. And I think when that decision is made, it will be a collective decision again. I think all of the health systems will make that decision together. It may be a rollout of a stepwise process where we begin to allow some surgeries to be performed that are not considered truly elective, that are more urgent need, and then roll that out further to elective surgeries over time. But I think that's going to really depend on how things progress over the next few weeks and what the governor does as far as the stay-at-home order and other things like that will impact that decision.
Thank you. Let me turn that over to Mr. Spencer. And sir, just kind of with your health system, whether it's surgeries or just other types of procedures, kind of what sort of time frame are you looking at there at Consegra?
Clearly, we're following the lead of folks like Dr. Adcock and the physician community who are actively engaged in communications on a regular basis, both within our community and outside our community, to make sure that we don't start anything too early. Clearly, I will reinforce what Dr. Adcock said with regard to the elective procedures being put on hold at this point. Certainly, there are still surgeries that are being performed on emergent and urgent conditions for patients. I would extend the conversation a bit, though, from our area of work to the dental services providers in the community. Of course, many dental procedures could result in the aerosolization of saliva and that sort of thing. So as you may or are likely aware, dental procedures have been shut down, except again for emergency procedures. So many of our dentist offices aren't even working at this point in time because of the very few numbers of emergency procedures that are required. We are open in all of our sites and providing very limited services just to emergency procedures. Thank you.
Thank you, sir. It's a great point about dental offices. Let me ask this next question to Dr. Robertson. I've got a good one here from Amy Brown, who asks, Gaston County numbers are much lower than those in Mecklenburg County. Is it possible some of their positive cases are actually Gaston County residents? And if that's the case, how many would there be? Dr. Robertson, I'll let you take that one.
That's a great question. Actually, when we are notified that we have a positive case, then we have to verify that they're actually a Gaston County resident. And so their numbers count for Gaston County. If there's a Gaston County resident that gets tested in Mecklenburg or Lincoln County or any other county, then their information would be sent to us, and then their positive number, or that positive case would be included in our numbers here in Gaston County. So we have an entire network where we communicate individuals' primary residency so that we can have accurate numbers related to the county that they actually reside in.
Good deal. Thank you, Dr. Robertson. Next question I have, we're going to ask Chairman Philbeck. Mr. Chairman, we've had the stay-at-home hotline that's been answering questions for a lot of folks, and this question comes to us from Keith and Sarah Cloninger, and they ask, when will small businesses be back open, and why are ABC stores considered essential? Mr. Chairman, I'll ask that question of you.
You will you'll probably have to ask some state folks that question as far as why are ABC stores essential. I've heard a lot of different opinions. I've heard that for some that may have an addiction in their community, to immediately shut that off could cause some issues. And I've also been told there's a lot of state money in the ABC stores, and that's why they keep them open. So I've heard a lot of different questions on that, or answers on that. I don't know the true answer to that as far as when it comes to ABC stores. As far as businesses in Gaston County, again, the governor's order and Gaston County's order both end at the end of the month. Now, the governor could extend his order, but we still do not know what that will look like. But it is my hope, and what I'm advocating for is that I believe that the current situation is not sustainable. I do not believe you can continue to tell people to go home, shut your businesses down, and there's no type of government benefit that is actually meeting the needs of our community right now. That's not sustainable. It may be through the month of April, but you can't do that month after month, or not only are you going to crush the economy, but there's health repercussions to shutting down everything month after month. There's economic repercussions to shutting down everything month after month. So my letter to the governor, and this helps answer your question about business, is not to pit Gaston County against the state, because we all need to work together. But we cannot continue to just think in a defensive position. We have to have solutions. And I'm not saying that we have all the answers, but here's what I do know. What we currently are doing now is not sustainable, and we have to find a way to protect the health of our citizens and put people to work. So it's my hope if our numbers and the metrics that we look at, local data, looking at capacity of our hospital, listening to our local doctors, listening to our health department, if our numbers continue to do well, we have got to move this conversation to safely put people back to work.
Thank you, Mr. Chairman. I've got this next question here, and I'm going to ask it for Pat Mumford. Pat, there's a question coming in from Christy Moss, and she asks, can we form a group to work with one of the local distilleries to get hand sanitizer made and put into our community? It's, for her, she's saying it's a hard item to find and it's much needed. What have you heard in terms of local distilleries working to produce hand sanitizer?
That's a great question. We have been in contact with several different companies. One is a chemical company that's trying to get through the process to become certified to do that or have the approval to do that. I have read of distilleries outside of Gaston. Don't know of any particularly here that are trying to shift over to that. But I do know there is a big effort in many different industry sectors to support this effort, not only hand sanitizers, but obviously masks and other protective equipment. So we can follow up and see if she has a specific distillery of interest. Generally, that is happening. I don't have a list of those companies offhand.
Okay. Thank you, sir. Let me get our next question to Dr. Adcock, and really kind of an interesting question here. It comes to us, and if I can, Angie's got a quick point, and Angie, let me bring you in to follow up.
Hi, Adam. To answer the question about local distilleries producing hand sanitizer, Muddy River Distillery in Belmont is currently doing that on a limited basis for first responders, fire departments, gyms, rescue squads, Department of Social Services, Public Health. They do have a link on their website should you wish to apply to receive, actually get into queue for that, and they would notify you when you could come by and pick that product up. They are limiting it, to the best of my knowledge, they are continuing to limit it to 2 gallons per entity, but we have received some here at the Department of Social Services and are extremely grateful to them for that donation. So that's Muddy River Distillery in Belmont. Thank you.
Awesome. Thanks, Angie. That's great. And thanks to Muddy River for providing that service. We've got a question here. I want to get back to the question for Dr. Adcock. It comes to us from Melissa Lynch. Dr. Adcock, to your knowledge, is there a committee of doctors that are advising policy leaders on the medical side of this pandemic locally? Dr. Adcock, let me ask that of you.
Well, early on in the pandemic, as it developed here locally within the state and then locally here in Gaston County, at Caramont, we set up an incident command center. And that incident command center was led by a team of administrators, physician leaders, a number of physician leaders. Our physician leaders that take care of our inpatients in the hospital setting, our intensive care doctors, our infectious disease doctors, our emergency room doctors, our strong clinical leadership in our nursing program here at Caramont, and then all of the support services around that. And so that incident command group has continued to work together. We meet daily. We have been meeting twice a day in many cases, even through the weekend. And that group has really been guiding all of the efforts that we've done here at Caramont to be prepared to take care of patients in this community that have COVID. So we have a multidisciplinary approach here at Caramont. That's always been our philosophy. We have strong clinical leadership that works very closely with our administrative team to provide the care that we provide to this community.
Thank you, sir. There's a question, and I want to ask it of Chairman Philbeck. Comes from Jane Taylor, and it asks, it's speaking to the care plan, And the question is, do we need to put $2 million into improving parking lots right now? She says that, I believe that money could be used to help the citizens. And maybe, sir, you can talk a little bit about kind of the different parts of the care plan and what each one is designed to do.
Okay, thank you. I've answered this question about 20 times. So a lot of these individuals just don't like the answer. But with that said, the care plan was put together by county staff and in conjunction with discussing with the health department, our public works department, and our county commissioners giving input. The care plan has 4 different phases. We have 3 shovel-ready projects, the Children's Advocacy Center. We have ADA compliance projects that we can do. And also we have a backlog of parking lots and things like that that can be paved. These are projects that were already on the books to be done and already allocated for. It was just going to be done way down the road. So what we decided is to move all of those projects up to help get people to work. So our electricians, welders, local contractors, builders, you name it, plumbers, will have an opportunity to bid on those jobs and get those individuals to work. The second thing we did is we have about $40 million in other capital improvements, buying vehicles, repairing buildings. These are things that the county has to do. So what we've done is try to fast track as quick as we can any of those projects, again, to help get people to work. The second thing third is the Family Advisory Board. We doubled the budget of the Family Advisory Board so that we can help those nonprofits in the community that can help those in our community that are impacted by COVID-19. And the last thing we did, and I'd like to give a huge shout out to our health director, Chris Dobbins, is we set up a plan whereby we can help folks with their car payment, their rent payment, if you're homebound, if you're in the foster care system, if you need assistance to pay for prescription drugs, if you have a vehicle that's broke down and you need to have some money to get that repaired. So what we did in our care plan was try to cover the whole area, from employers to those that have lost their job. Is it a perfect plan? Absolutely not. But is it a good plan? I would say if you've waited on your unemployment check for the past 30 days and you still haven't got it, I think this is a good plan. If you're still waiting on the federal government to do all the different things that they said they were going to do, this is a good plan. I'm going to give you 2 phone calls I had. I had a gentleman call. Him and his wife both lost their jobs. They needed help paying rent. They applied for unemployment, could not even get on the system. For 2 weeks, could not even fill out an unemployment application. This care program helped pay their rent while we wait on Raleigh and Washington. I had a gentleman call who needed some prescription drug assistance for a COPD medication. He had lost his job. Through the care plan, we were able to assist that. So I think putting people to work, meeting the needs of people where they're at, is a good idea. And I'm thankful that we didn't wait on the state or the federal government to tell us what they think we should do, that we went ahead and met the needs of our community to the best that we can. I want to applaud Mayor Walker Reed, who I have worked with very closely and Robert Kellogg, who I've worked with, and what they are doing, the same type of things in the city of Gastonia. Belmont, Mount Holly, creating programs to get loans to their people. These are all good things in our community. None of it's perfect, but it's imperfect people fighting something we've never fought before, trying to help the people. Thank you. Muted.
Thank you so much, Austin. Let me put this question to you. This is coming from Robert Kellogg, and really kind of a good question. I know that your team has been working on mental health. He asked, is there a concerted effort to address the growing mental health crisis as this emergency stretches out over weeks to months? Will there be additional resources and funding for mental health professionals and behavioral health experts to deal with the critical care needed? Now, I know you can't talk to funding, but I know you can talk about kind of what you guys are putting together from your task force.
Yeah, well, I can speak to funding and that we're seeking it. We started on that, I would say, a week and a half ago, applying for grants. We've put in for a $50,000 grant, and we're not, we're hoping we're going to get that, but we're going to continue applying for other things. And we're putting that money into the Gateway, which you might be familiar with. If you don't know what that is, you can access it on gastoncovid.com, see the information. But we've also vetted a list of counselors, professionals in the whole mental health world. So there are kind of different categories of people. If you go to our website, again, gastoncovid.com, you can see who we vetted. And what we're doing is we're saying, if you can't afford to go to one of those, then go through the Gateway, and they'll do their process that they go through to determine your financial need, and then scholarship you into one of those 18 that we vetted out. And we also are doing that because we feel like the residual effect of this. So if the economy was all open back up tomorrow, the residual effect on marriages, on the mental health of people who are all of a sudden dealing with trauma they've never dealt with in their whole life. They've got a loved one that died in the hospital and couldn't go see them. And so there's so many different things that are hitting, and we feel like that's going to have a residual effect in the coming months. And so we're trying to posture the finances, as well as we said, the counselors and mental health professionals that we've had great experiences with. So we can say to people, hey, there might be others out there that are awesome, but we can personally say that all 20 of us on this task force can say these people we've had good experiences with. So that's kind of the angle we're going, and we're going to continue trying to get those funds to help those who are in economically difficult situations to be able to pay for it.
Awesome. Thank you, Austin. Let me turn it over to Angie Karchner from Department of Social Services. I know that mental health is one of the things that you guys have dealt with from people calling in.
Yes, Adam, we have. Actually, we are working very closely with Partners Mental Health, and I can provide some links to some resources for you to put out on the website for our community to access. Again, I just want to say, if folks are without insurance right now, we would encourage them to apply for some of our Medicaid services. You can do that online, or you can come into our building. We do have paper applications that are available here for individuals, and those Medicaid services can assist with mental health costs as well. But I can provide you some of that information for Partners here in Gaston County. They're a wonderful agency and have reached out to provide services for our community.
Awesome. Thank you, Angie. We've got about 10 minutes left, and we know to everybody that's asked us a question. What I'm going to try to do afterwards and working with Deandra here in our public information office is to make a list of kind of the most asked questions that we didn't get to, and then we'll try to get some answers to those and put those up on our Facebook, both our Facebook page and the county website to be a resource for folks. We are going to get a few more questions in before we're done. I'm going to go back to Dr. Robertson because one of the popular questions that we're getting deals with testing. And one of the things that people have asked is, what are we trying to do in terms of vaccines for people returning to work? And also a question from Sharon Udis, how confident can we be in the numbers when the testing is still somewhat limited? So let me go to Dr. Robertson on those questions.
Hi, Adam. So those are two really good questions. The first question, and Chairman Philback's already touched on this a little bit earlier as well. In waiting for a vaccine, it may take months or even a year before we're able to access an effective vaccine for COVID-19. With that in mind, our economy would not be able to sustain that period of time without reopening businesses. So we do not see that we'll be requiring the vaccines to reopen businesses at this time, since we do not have one available. But our approach to reopening businesses will be very much a strategic plan in order to monitor any spikes and outbreaks in the number of new cases of COVID-19. We certainly encourage all to continue the current precautions that we're using, to include washing your hands with soap and water for at least 20 seconds, covering any coughs and sneezes, making sure that if you aren't feeling well, that you do not go to work, and maintaining our social distancing with 6 feet apart when we start to reopen our businesses. And that will help as we continue to monitor the disease progression in our community. And Adam, I believe you had a second question. Can you repeat that one for me, please?
Yep. Get back. It was from Sharon Udis, and she asked, how confident can we be in the numbers when the testing is still somewhat limited?
Yes, this is an excellent question. The only way to truly get an accurate assessment of what the disease looks like in our community is to have universal testing. And our nation doesn't have the capability to do that at this time. However, what we do have are standards that we're using that's consistent all across the nation. Basically, we're following the state and federal guidelines on how to prioritize testing with the resources we do have. And that's consistent with all of the other communities. So we can be confident that the numbers that we have now are numbers compared with the rest of the nation using the same guidelines. Thank you.
Awesome. Thank you so much. One of the questions that we're getting in, I want to ask this one of Linda Slade over at the United Way, getting questions about how folks, this comes specifically from Susan Brown, and she asked, how do I submit a request for nonprofit funds? And Linda, kind of what has been the process like in terms of the nonprofits that you guys are working with and helping fund through that virus relief fund?
Good question. You can easily log in to helpgaston.org, and that's the website, and I'll be happy to share that with you, Adam, to put on your county website as well. The application process is there. It's a very simple application. Our committee reviews these every week so we can make quick decisions and turn this money around back into the community as quickly as possible. So any application that is received by Friday is reviewed by the panel, and the decision is made the following Wednesday, and the checks are immediately cut and sent out. So helpgaston.org, you'll find all the information. Again, it's a very easy application to complete.
Awesome. Thank you very much. I'm going to see if I can ask kind of a question that gets to kind of the balance that we're trying to walk right now. And I think we're going to go to Chairman Philbick with this, and then I'll also ask a similar question of Mayor Reed and Mayor Coleman. But one of the main questions we're getting is as leaders, how do you plan to balance the financial health and physical health of Gaston County versus where we are in the crisis of coronavirus and the health concerns. Mr. Chairman, I'll start with you.
Okay. The question is, how do we balance?
How do we balance basically the financial health and the economic of the shutdown versus the need for protecting people? And that's been kind of the big conversation through all of this, I think.
Okay. I think we have to look at what Gaston County has done. Before the state issued an order to limit gatherings, Gaston County did. Before the state issued an order looking at certain businesses that we know the data shows you could have large spread and addressing those businesses, the county did. Before the state looked at a stay-at-home order, the county did. And when I say the county, I'm talking about every municipality within the county as well. This order was signed on by every mayor and every city council in Gaston County. What we were able to do was be proactive. You'll hear a lot of individuals say, you guys don't know what you're doing. You should just wait on the state. Well, if Gaston County would not have been proactive and put these measures in place and just waited on the state, we would have more deaths and we would have a higher number of confirmed cases. I would argue that because our cities and our towns and our county was proactive, we were able to keep our people safer. With that said, as we look at what we've done, we've seen some of the data already come back on a local level that tells us, hey, we have some hope. That doesn't mean that we're not going to see a spike, whether we stay at home or not. There's still a lot of unknowns. But once you start looking at the other side of shutting down government, we have major health consequences of shutting down government that have nothing to do with COVID-19. You have major mental health issues that are on the other side of shutting down government. You have major financial issues for our government, our local economies, and more importantly, the people. So in fairness to our president, in fairness to our governor, and in fairness to any elected official, these are hard decisions, and I doubt anyone has the right answer that's going to cure it all. But as we balance protecting our citizens, we have to balance that with putting people back to work. And I believe you can do both. As someone who values life, I also value people's human dignity to where they can financially take care of themselves. So it's a tough position to be in. None of these decisions are made in a vacuum. They're broad consensus from Caramont to state models, local models, looking at our health department. I can tell you every one of these decisions I've prayed about very hard. And no matter what decision we make, some people are going to like what we do. Some people are not going to like what we do. But I think in this situation, if we can continue as leaders to keep politics out of what we're doing and work with each other, we can put people to work safely and keep people safe. As you heard the doctor say, it's not sustainable in the current scenario. And we're not talking about opening everything up today. We're talking about at a future time, hopefully sometime in May, if the numbers are good. But even at that, you've got a lot of data and a lot of information to pour over. But we as leaders the same way we were proactive in protecting the citizens of Gaston County instead of waiting on the state. We need to be proactive in making sure that we protect the health of our citizens and put people back to work slowly, incrementally, and in a safe manner.
Thank you, Mr. Chairman. We're almost at the end of our time, but I would like to give both mayors Coleman and Reed a chance to kind of speak to what their message has been to their citizens throughout this crisis and going forward. So Mayor Coleman, I'd like to turn to you first.
Thank you, Adam. I think Commissioner Philbeck answered it very, very correctly. We got out in front of the situation also before the governor's order came down. We'd already decided we would not have our late fees, reconnection fees, and things like that. And we were already in the process of setting up a payment plan before the governor's order come down. Being a small town, we are limited in our funds also. The lack of timely payments to the town does affect our budget. So we are probably more limited in what we can do as far as what the county is doing. But also, as being citizens of Dallas, they are citizens of the county, so they can rely on some of those county plans that are in place.
Thank you, sir. Let me turn it now to Mayor Reed of Gastonia. Mr. Mayor, what have been some of the toughest conversations that you've had throughout this process, and what has been kind of your message of hope for people going forward?
First of all, thank you, Adam. I would like to commend Commissioner Philbeck for reaching out to me as well as others throughout Gaston County and his leadership and the forward thinking to address this issue. This has been tough on everyone. I mean, it's basically been the fear of the unknown. We've never had to deal with a crisis like this before. And I think all of us have really done the best we can to try to address it. I'm also thankful for a creative management team with the city of Gastonia. This has affected our budget tremendously. I mean, when we allow people to go without paying utility bills, that's revenue. It's not coming back to the city. We'll have free bus services now. That's revenue that comes back to the city. The lack of sales tax and hotels and motel tax, they are lax now because they're not doing the business that they normally do. So this has created a tremendous impact on governments across the nation. All I'm concerned about at this time is that we work through this, that we have patience with those in authority, that we follow the lead of our government. Our governor has a tremendous task as far as calling the shots for the state of North Carolina. The various mayors around and within the state of North Carolina, as well as our council members. I mean, our management team, along with our staff and council, has been in several meetings. Several people have mentioned they hadn't seen me out. That's simply because this is a health and human services issue. I have played the role that I need to play as the mayor. I know how to stay in my lane, and I have taken instructions from those that have given us instructions to follow through with. Also, in order to be a good leader, you must be a good follower, and that's what we've done. We followed the lead, and I agree wholeheartedly with Commissioner Philbeck that due to the fact that we got out in front of this thing earlier is the reason why our numbers are showing the way they are. So I would encourage everyone to continue to keep the faith, keep us all in prayer that this thing may come to an end, that we all can get back to normal. Thank you very much.
Thank you. And I want to close today. I want to thank everybody on the panel for participating, everybody who's watching and has submitted questions. I do want to close with Vice Chairman Brown with one last thought. Vice Chairman, you've been on the board, and this is something obviously that for a lot of folks is kind of unprecedented. Can you speak to, just from your viewpoint, what you've seen in terms of the response and, maybe your message to residents going forward?
First off, this is the worst I've ever seen it. Matter of fact, going back to the polio epidemic back in the early 50s and late 40s, and when they were asking everyone to stay at home, especially the children, because it was more contagious to that group than anyone else. The overwhelming experience I've had with this is the fact that how many people have come together as the ones that's on this call today, as well as the ones that own businesses. I know there's some businesses out there today that are helping their employees with their pay, even though there's not work coming through. They're just things that we should take a look at in the future because take what they're doing. So it's been really important to me to see what's going on. And I think, like Mayor Reed said, we all got to work together. As long as we can do that, we can continue to progress, get this over with. Thanks very much.
Thank you, sir. Again, thank you to everybody on the panel, and we thank everybody for watching on Facebook Live. As I mentioned a little bit earlier, for those of you that have asked questions that we haven't had a chance to get to, our staff will go through and get those out to the different panelists to try to get some answers on the ones that are kind of the most popular questions that we didn't get answered here in this time period. And then we'll make that available on the county's website, gastongov.com/coronavirus. That's the kind of the main place to find all the resources that have been talked about here today. And we want to thank you so much for participating and taking the time to watch. Thank you so much.